Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to this episode of Bristol Health Cares. I am Kurt Barwis, your host. Today we have a very special guest who's going to talk to us about our Rehab Dynamics program. Physical therapy, PT, OT, speech therapy. So today I'm going to introduce to you Bridgette Lee. Bridgette, welcome. How you doing?
Good, Kurt. I'm very happy to be here.
So it's really great to have you here.
Thank
Tell
you.
us a little bit about yourself. You're kind of new for our team.
I am. This is my second month here.
2 months.
Joined at the beginning of 2024. Very exciting. And I feel like I learned so much in those 2 months, so very excited to be here.
And I understand you have a connection to Bristol itself. I didn't ask you where you live, but you were born at Bristol Hospital.
I
heard you
was.
say that.
I was.
So really important fact to
It
get out there.
is, so it's in my heart.
So that's awesome. So tell us a little bit about, you manage and oversee Rehab Dynamics, which is, it's a pretty massive program, right?
It is. It's a very large program. We currently have 13 physical therapists, an occupational therapist, and a speech therapist. We do all outpatient physical therapy services for the community.
So you have a new facility in the medical center downtown.
We do.
Somebody actually kind of slipped those drawings. I never really saw them to approve that. And when I walked in there and saw it, I was like, this is like
It's
what a
huge.
professional sports team would have.
It is.
It is just drop dead gorgeous and extremely well designed. At least that I just walking through there, I think that it should be an attraction for people who want to practice PT, OT, speech therapy, right? I mean,
Absolutely.
they come in and they go, this is like a great environment to work in.
It is. It's open. It's very bright and airy. We have windows all facing out where the old town hall is or was at Riverside Avenue. So it's a gorgeous facility.
Yeah.
As soon as you walk in, everybody is welcoming, and we have an awesome music soundtrack as well.
Oh, I didn't know that.
Oh, we do. Yes.
That's good.
So everybody's very energetic and welcoming, and we have state-of-the-art equipment in the facility as well.
I know, I paid for all that.
Yes.
No, but
yes.
it really is it was the right thing to do. So talk about the range of services. I mean, you mentioned them, but do we do just about everything that anybody might want to have in terms of PT, OT, speech?
Yes, we do everything. PT, OT, speech therapy. We also offer aquatic therapy 2 times a week at a local facility right here in the city, as well as work assessments for many local businesses in the area, performed by our in-house athletic trainer.
Really?
Yes.
I didn't know there was aqua therapy.
Yes, 2 times a week we offer that.
2 times a week. So that's really, so where is that?
It's at one of the schools.
At one of the schools?
At one of the high schools, yes.
Okay. And you said we have 13 physical therapists between the 2 locations.
We do.
So how does someone end up getting into our facility for physical therapy?
So everyone who receives physical therapy services at Bristol Health needs a referral from their current treating physician so that we know exactly what to treat for.
Yeah.
They give us the exact diagnosis, and from there, we can schedule an evaluation, and then we will schedule all of the follow-up visits after that. So everything can be done right there at your first visit.
Yeah, it's a great environment when people first walk in because I think it kind of relieves a lot of anxiety and stuff like that. And so how do we, like, when you think about like outcomes, how do you measure outcomes?
So right now we measure our current treatment time,
Yeah.
as well as how long it takes to get patients in the door as well. So there is a big need in the community for physical therapy services. And right now we're trying to get everybody in the door here.
Yeah.
Yes.
Yeah, it seems like over the years, it seems like the need for physical therapy, and that may be partially because our community is an older community, and I fit that part of the community, and the need is greater, and we've tried to
Absolutely.
expand those programs.
Yes.
We continue to hire individuals. I think the only limitation to our growth is finding the right people
That's right.
to join us, which is a part of your responsibility is to
Absolutely.
recruit
I
people,
am in
right?
charge of recruiting,
So-
and we are currently looking for physical therapists to join our wonderful team. And we're even looking to expand out to a new office in 2025 for our current office on Route 6. So we're looking into the future with both offices at both ends of town, very conveniently located for everyone.
So we do some kind of unique things too. Like I think this morning I did a town hall meeting
Yes.
at the hospital very early. It was like 7:30, I think.
Yes.
And one of the staff members, talked to me about their journey. That just had a baby, had a C-section,
Yes.
and in a hospital, people kind of just, they talk freely. It's a
Yes.
pretty interesting environment. I have to stop myself often when I'm out to dinner.
Yeah,
But,
absolutely.
she had indicated that she had delivered, had the C-section, and she's very young, and then had an issue with incontinence. Like, it was like shocking to her. Like, how can this be?
Yes.
And so she started kind of researching options. And she's been doing physical therapy for they call it pelvic floor
Pelvic floor therapy.
and she was like, and I want to tell everybody because it works. And I guess she had to find a specialist to do it. Do we have somebody like that?
We do. We have women's health therapists at our locations that could treat those types of issues. And we also have certified men's therapists as well who could treat incontinence, pelvic floor, breast surgery, both pre and post-op. So we also handle those patients as well.
It's really, so now the example that I gave you was of somebody younger having a baby, but what about older women who have incontinence? You can go after that too?
Yes,
I mean, you
we
can
do.
try
Of
to help
all age ranges,
It's all age ranges
except for pediatrics.
for pediatrics. Okay.
That's the only age group that we currently do not serve, but anyone else?
So when you say
do.
pediatrics, is that like how young does that go to? So what age would you start to treat at?
Around 18,
Around 18?
yes, where they could sign off for consent for treatment.
Got it. Okay. Is that a big need in our community? I'm curious. Do you think? I mean,
It
a lot of
is.
sports
There
programs.
are a lot of sports injuries, and we do have an in-house athletic trainer who I mentioned earlier, and she actually works at one of our local high schools.
So she does. Okay.
So there is a need.
And we actually have two surgeons who do pediatric surgery. Actually, more than that. But one is sports related, Dr. Lavery, and then his wife, Dr. Allison Sorokin. She does hand surgery, but they both do kids, which is really kind of an exciting thing for us.
We just got to figure out now how to do the physical therapy for kids.
And the kids absolutely love our gym area. They come in with their parents and their grandparents, and we
Yeah.
always welcome them in so they could sit and watch. We
Yeah.
love having them.
So we have the full range for physical therapy. How about speech therapy? I mean, that's
Yes. We do offer speech therapy as well at the Medical Care Center. We have a wonderful speech therapist there who handles all types of speech-related issues, such as she does speech articulation, memory care, and other types of voice disorders.
yeah. I don't know. I think she was on the show. I think she was on the show at one
Oh,
point.
good.
But
Yeah.
I didn't understand the range of issues that people can have with speech. Like,
Yes.
you know, somebody who's got dementia and
Yes.
Alzheimer's, they forget how to swallow and those
They
kind of
do.
things. And so it really kind of heightened the need in my mind for having that therapy available for people.
Yes.
I also know people that there's a lot of individuals that have chronic cough now,
do.
and their voice has, changed. It seems very odd. It just seems like more and more I talk to people. I don't know if it's a long haul issue or something like that, but
Definitely.
you can actually go to a speech therapist to actually help you regain your voice. You know,
Yes.
you may have an inflection in your voice. And how about occupational therapy? How does that work? What's that all about?
So occupational therapy is really related to workers' compensation. So if you have an injury on the job, your claims adjuster will send you a script for physical therapy, and we could help you and schedule the evaluation.
So I noticed there's a table in the back for hand therapy. Is that a
There.
pretty common thing?
It is. It is. We have a lot of hand, wrist, elbow, and shoulder injuries. So they are all connected.
Yep.
And we have specialists who handle those types of issues at both of our locations.
So generally, people that get referred in, obviously they can have, injuries or issues that cause pain.
Yes.
How do you this is always my thing to think about is I'm going to now go and do physical therapy.
Yes.
Is it going to make the pain maybe worse for a little while before it gets better?
We try to schedule out, it's usually 2 times a week, and we try not to do it back to back because it is intense. We try to treat, and movement is the most effective way
Yeah.
to treat those types of injuries and post-op related situations.
Yeah.
So if you're feeling that, that's a good thing.
Is that what you?
It
I guess
is a
that's what
good
you
thing.
tell patients. The
Yes.
little pain is good, right?
Yes.
But it's hard. It is really hard.
It is.
So we had a physical therapist that used to be in the hospital that was out over in Medical Center, Sheila. Really amazing. There were times I had spinal issues and ultimately had spine surgery.
Yes.
And with my schedule, sometimes I would travel a lot.
Yes.
And so if I had to travel, but I was really was unable to move and stuff like that, Sheila would come up and put me through those exercises.
Yes.
And, she was always right because, a little bit of pain ended up solving the problem usually. But there was a hesitancy to actually do it. And then the worst thing that, she convinced me the worst thing would be to not do the exercises because
Yes.
you're not going to fix the problems, and often
Yes.
medication doesn't fix the problem. So, it was, to that point, it was really kind of tough. And maybe I was a little spoiled because I could get right in and
Oh, yeah.
yes, but I really learned how to appreciate what they do, and how important it is for our community to really, you mentioned work, and a lot of times people, whatever their job is, they can't do their job unless they come in and they get better through getting to a better functional level to be able to do the work. And it's not that people don't want to work, it's they may not be able to work. So
That's right. And we don't want to get them re-injured or
Right.
worse. And you did bring up an excellent point about doing your exercises at home as well. It's a partnership all the way through. So even on your off days,
Oh,
we
yeah.
do expect some work from home with the exercises. But our therapists actually have a YouTube channel where they show you exactly what to do.
Really?
And they give you handouts as well, so they guide you right along, so you can do them at home as well.
So is this like a private YouTube channel? Like, do you need to like have a password to get into it, or anybody? Can
No,
watch it?
anybody could access it.
Wow, that's really cool. So this,
Yes.
you just taught me something. But what you're saying is true. I think, with having gone through spinal surgery and then taken a year to recover from it, there's not a day that goes by that I don't do my back exercises.
That's right.
Well,
Yes.
maybe this morning because I had a 7 a.m. meeting, but
Yes.
normally I will do my back. And my wife will remind me,
Yes.
did you go down the basement and do your stretches for 20 minutes? And
Great.
and it definitely makes a difference
It
because
does.
there's things that I couldn't do before that I can do now. And I can do them without worrying that I'm going to be halfway through like a round of golf or something like that and not be able to play and have to leave, which can be really disruptive to everybody else when that happens. But
That's right.
so the program it's very busy,
It is.
and you're going to recruit
Yes.
some more people, and we're going to grow.
Actively recruiting.
And you talked about another location that would be on Route 6. We're looking at how we can improve that location.
Yes.
How about in Southington? Do we have anything in Southington at this point? We have a new medical center there.
We don't for physical therapy at the moment, but that's a huge growth area.
Yeah.
We have a beautiful new primary care building there, right on Main Street. And we have another one as well, I believe, right up the road in Plainville.
Yeah. There's several locations, and I think being able to reach out and
Yes.
offer those services is really important. So a lot of individuals in our community, have hip fractures and different problems that are, are created through a fall or some other unfortunate accident.
A
And
motor
they-
vehicle accident,
motor
we have a
vehicle,
lot of
yep.
those as well.
And so they come into the hospital, they go through the process of if they need surgery or they get healed. And then there's the physical therapy piece of it. I know I started with home physical therapy,
Yes.
and we have home physical therapy.
We do.
So how well do we coordinate a person's kind of journey from when those episodes happen? I mean, what can somebody expect? That it's kind of seamless, like if you unfortunately have to have surgery or you're in the hospital, the coordination between, from the episode start until the end, how does that work?
So we do have those patients who are post-op or post-home care are our main priorities. So we usually have, we leave open spaces for them. So we get them in sooner than other types of situations. So anytime that we know there's a surgery ending and we have people call our facility right directly from the hospital, and so we know exactly when to get them in for.
So
Same with home care.
we prioritize that. We keep appointments.
We do.
So that's a really good thing, because if you need to be able to go through the whole process to get from beginning to end, which
Yes.
is good.
And we don't want them to wait too long.
Now we have we've kind of a unique setup because we have a physiatrist as well. In
Yes.
that now does his offices are with the orthopedic group?
Yes, that is
Yeah.
correct. Yes.
How, for me, I really didn't understand that whole discipline, but now that I've learned more and more about it, having a physiatrist to kind of break down the why, because sometimes it's not an accident, it's not a fall, but somebody's experiencing a difficult problem.
Neurologic.
And
Could be-
neurological.
It could be neurologic. We do have a vestibular specialist over at the medical care center for physical therapy. So if you're experiencing any dizziness or difficulty in that area, we could treat that as well.
What did you call that person? I'm sorry.
It's called vestibular.
Vestibular.
Yes.
Okay.
VEST.
And
Vestibular.
so that person would get a referral from a neurologist or
Yes.
a physiatrist.
That's correct.
Yeah. It's really an incredibly integrated and an organization where the physicians and the treatment individuals really do talk about each individual patient and kind of navigate them to the right place.
That's right. And we love to have Bristol Hospital, Bristol Health patients because the communication is so wonderful in-house. We also take external patients as well, but the system we currently have within the Bristol network is phenomenal.
Yeah, it's interesting you say that. We had a medical staff meeting for all the physicians within the medical group a couple weeks ago, and after that, like last Thursday night, I was out with Dr. Bodansky, Craig from Southington.
Yes.
And he was talking to another surgeon who is contemplating joining our medical staff, and he went on about how the collaboration, like they had that meeting. He opened the door to our conference center, and it was early in the morning, like 7 a.m. or 7:30,
Yes.
and the room was packed
Yes.
with the physicians and the APRNs and PAs
Yes.
all in there.
Yes.
And I got to be honest with you, I've been doing this for a long time, and I used to remember, when I first started, there was always a medical staff meeting, once a quarter, a luncheon or a breakfast or a dinner, and all the community physicians would come, and it would be a way of collaborating. And
Yes.
I think the relationship that they have with each other then helps patients because they're more apt to pick up the phone and say, hey, I have so-and-so here, I see this problem, and I'm going to refer that person to you. So for me personally, what you just described, and then seeing it in real time in the year 2024 when everybody's so busy is really, I think, one of the most important, things about our organization. And it helps the healing process.
Yes.
It actually has resulted in our high reliability being extraordinary in terms of patient outcomes and patient
Absolutely.
safety and
Yes.
quality. So
And satisfaction.
and the satisfaction too. Yes.
We have wonderful patient satisfaction comments.
I do see those comments, and
Yes.
it's really, and then I get a lot of mail from
Oh,
patients,
great.
and then I forward them on. So
Yes.
so
Fantastic.
so in the last minute or so, what do you want to tell the viewing? What do they need to know about our whole Rehab Dynamic program, and what are the important key takeaways that they really should know?
So they should know that our team is here to help everyone in the community, and we really view each and every person who walks in our door as part of our team.
Oh,
We're not separate from the patients. We are part of their care team, and we really go through a lot of big major life changes with everyone. We have a lot of returning customers. We've had babies, marriages, graduations, all the way through. So we really become family.
yeah, that is a unique feature of the health system itself. All parts of it are that way. So,
Yes.
Bridgette, thank you so much for being
thank
here,
you.
and thank you for joining our family.
Oh, thank you.
Really,
I
very
really-
much appreciated, and
Very happy to be here.
and I'm sure we're going to see great things and
Thank you.
and a growth in that program for the community. and
Absolutely,
the
we're
needs.
very excited.
So this is Kurt Barwis, Bristol Health Cares. You can write me with your topics, things that you'd want to hear about on this program at cares@bristolhospital.org. Again, that's cares@bristolhospital.org, and we'll work to get whatever that is on the program. I want to say special thanks to Nutmeg TV. This is a high definition studio. It's extraordinary. It is an amazing community resource, one that I'm very proud to be a part of or be able to use. Programs like this wouldn't happen if we didn't have a nonprofit TV studio like this. So please support this program, this organization with your dollars. Contribute if you can. And until next time, stay healthy. This is Bristol Health Care's Kurt Barwis signing off.